joining us. And we look forward to your contributions and to your around this topic from your experiences in different places, in different countries. So just a reminder that this is a free space where you can contribute your thoughts. So do not hesitate at any point to contribute to the conversation, because the idea behind this is for everyone to also to learn for all of us to learn from each other and to learn from our different work. So we encourage you to introduce yourself in the chat. My name is Tinashe Goronga. I'm based in Zimbabwe. I'm a medical doctor and public health specialist and one of the co-founders for Center of Health Equity in Zimbabwe. So we encourage you all to introduce yourself in the chat. Tell us your name, where you are calling from, your organization, and any other information that you think would be useful. We have interpretation for the session, so we encourage everyone to speak slowly so as to allow for effective interpretation. So to access the interpretation, you click on the globe, then you click on the language, your preferred language. For this session, we have French or English. Yeah. Then as the conversation goes on, if you'd like to speak, you please feel free to use the reaction for raising arm. Then we'll encourage you to unmute and speak. But yeah, we look forward to your contributions and we look forward to the conversations, and thank you all for coming. I'll hand it over to Hashim. Thank you.
Thank you very much, Tinashe. Good morning, good afternoon, good evening to everyone. My name is Hashim Mubati. I'm a medical doctor as well and public health specialist. I'm based in Benin, and I welcome you all to the conversation that we are having now on the Climate and Health Journal Club. So the discussion will revolve around climate change research in Africa, and more specifically, the funding flows. Where do they come from? Where do they go? And I will have the pleasure to introduce you the article by Overland and all, 2021, which will be the base for our discussion. So the article started by highlighting African regions according to eco region, and you can see that Africa has diverse eco region. In the literature, it is known that Africa, as far as climate change is concerned, contributed a small fraction to the crisis, but still is disproportionately affected by the climate change. This implies that in a continent where the effects of climate change are disproportionate, we have much more research efforts to make sure that we understand the scale of the threats and what to do about it. This implies that we have funding that go to research on Africa as far as climate change is concerned. But as we will see much more in detail later, the climate research, Africa-related climate research funding, since 2010, so this is a compounding figure, exceeded 4% the research in general, and climate change, climate-related topics is only 10% of the overall research on the continent. So how did the authors found the data that they use within the article? They extracted data from a database which is known as Dimensions. So it is known as the world's largest research funding database. And they based their work on research grants, amounting 1.51 trillion US dollars, spanning the period from 1990 to 2020, so up to a 30 years period. What did they find? First, their first findings were that out of the 100% global funding, the Africa climate-related research amount to 3.8%, bearing in mind that it is the continent that is one of the most affected by the climate crisis. We only have 3.8% of the global funding to finance climate research. In a context, as I just mentioned, where it is one of the continent most affected, in a context where we have a fifth of the world population in Africa. So we understand that that amount of money is just ridiculous compared to the extent of the threat and the needs that are there for funding. So remember, we said that we only have 3.8% of global funding that is channeled to climate research in Africa. Considering that that is 100% of all the money in Africa, it has been noticed by the authors that up to 80% of the money is channeled to institutions from Europe and North America. So you can see on the diagram in the, I hope you can see my keyboard, my mouse. So you can see that the most important countries where the money is channeled to are the United States, the UK, the United Kingdom, Germany, and Sweden. So those are the countries where the large amount of the money go to. And countries like Kenya, South Africa, Tanzania, Ethiopia, Ghana, and Zambia are African countries where institutions receive the most money compared to other African-based institutions in other countries. So that is where the money goes. So where does it come from? And we will turn back to the first diagram, the A. So the UK, the European Union, and the United States are the main contributor to the climate research funding in Africa, followed by all the countries that you can see there. So mainly European countries down there. So we have the figures before the Paris Agreement and after the Paris Agreement. Because during the Paris Agreement, one of the resolutions taken was the funding to make sure that countries that did not contribute a lot to the climate crisis are able to receive money as a sort of compensation from those who contributed to the crisis. So to sum up, we have 3.8% of global funding for climate change research that are channeled to Africa, and the large amount of that money are channeled to institutions, research institutions based in Europe and North America. And the large amount also of that money either come from those same places, basically. Europe, North America, and marginally some Asian country like China and Japan. So what are the topics that are prioritized? You'll see the different geographic, and that's why we show the different zones at the beginning in the introduction. So we have Southern Africa, Central Africa, etc. And you'll see that most of the countries, most of the money go to former British colonies compared to other African countries. So we have already seen this before. Most of the monies, if you type climate change Africa in any database, most of the research will be research from South African institutions. If you are looking for African institutions, most of the research will be from South Africa. Of course, most of the research will be from institutions based in Europe and North America. But if you want to see what's happening in African institutions, you will see former British colonies at the top, and we have already listed them. Kenya, South Africa, Tanzania, Zambia, etc. So when we talk of climate change, we can mention the impact of the crisis, of the climate crisis, the adaptation strategies to kind of adapt to the damages that we already have, and the mitigation strategies to make sure that we mitigate, we kind of make sure that we are not adding to the problem. So, of course, those who bring the money are the ones who set the agenda. So that's what it's about. They are the ones who set the agenda. And the authors find that most of the time, they put in the call, they already prioritize what they want to focus on in their call for proposal. So looking at the calls, they have seen that impacts and adaptation are the two main topics that are prioritized, and mitigation is given less priority. So the logical conclusion from this, as we have said, is that the people, the institutions, the countries that control research funding are still the one that will set the agenda, the research agenda. And these calls for innovative reflections to find alternative way to quantitatively fund research in Africa, but also qualitatively funding research in Africa in terms of where the money comes from first, and also how we make sure that the ownership is on site. And what the authors found also is that most of the time, the first authors are European or North American-based institutions, actors, authors, and most of the time, the way it is framed is framed in a way where the call comes with a capacity building component. So the capacity building component is for African researchers who merely support, they come as support for the European or North American institutions. The authors call for financial innovation so that we find solutions that support climate adaptation in Africa, of course. And they suggest that the climate change research is much more diversified. For now, it is very towards impact and adaptation, and not much as diversified as it should. They also suggested that there is an increase of funding for researchers that are based in Africa to strengthen their ownership on climate change responses, and finally, to improve transparency and accountability in funding streams for climate change research in Africa. So I just wanted to point out that, again, the researchers that did that research are not African. So, yeah. Thank you for having me. I hope that I was able to comprehensively sum up this, and I'm looking forward to our discussion. Thank you very much. And Tinashe?
All right. Thank you so much, Hashim, for the summary. And unfortunately, one of the authors could not join us. They ended up having and being tied up. But we encourage, yeah, we look forward to the conversation. So just to emphasize that this is a collective discussion to learn from each other. So if you'd like to speak or comment, feel free to raise your hand. If you'd also want to share some of your work that's related to the topic, feel free again to share. But I think we can all agree that research, particularly, is a huge priority if we want to talk about evidence-based interventions. And I think the data is also important to inform policies in our work. So I think it's really important that we have this conversation about how we can have sustainable funding long term, and really think about some of the recommendations that are there and some of the gaps that are there. So yeah, Samson, I see your hand is up. Feel free to share your thoughts.
Thank you, Ashim, for the presentation and the insights. I totally agree with you that this whole thing should be African driven. But I also feel that if we do not have domestic funding, we cannot reasonably control the agenda, as well as the organizations that do the research. So for me, the issue is not about why European countries or American countries are funding Americans or are funding Europeans. The question is, why are we not raising our own domestic funding as African countries to drive the agenda? Because if we continue to wait for these handouts, the ones who give us the handouts who draft the agenda for us, so sustainability will come from domestic funding. And how do we raise these issues with our respective governments for them to understand that they should drive this agenda? It benefits us, it benefits them as policymakers, and also deciding our own future. So for as long as we are leaving our own fate in the hands of others, starting from fundraising, it will determine who they give the funding to, as well as who they ask to do the research. We do have research councils in our own countries. We have got meteorological departments in our own countries. We have ministries of environment and climate in our own countries. How do we harness them to drive this agenda instead of saying to those that are giving us the money, don't give us the agenda, but give us the money? Thank you.
Thank you so much, Samson, for bringing the importance of domestic funding. And I think it's something that we really need to prioritize. I know our governments have made so many commitments to increase funding for health. Um, I mean, there's the Abuja Agreement and the different frameworks that people have talked about to increase funding for health. But some have been failing to meet the targets. And I think in the broader conversations that have been happening around some of the avenues around domestic funding is making sure that when people are discussing climate financing, carbon credits, some of the funding actually goes to health-related research, considering the impacts of climate change and health, and also around issues about holding accountable the biggest emitters to also start contributing around uh, to start contributing towards health. So I think there's an issue of I think I view it from viewing like multiple sources of funding and not just domestic, but also international, considering that some of the biggest emitters are actually not on the continent, and the continent is being affected the most. Some of the people have uh, are advocating for climate reparations and no. But I think the main question is from the domestic and the international perspective of how do we ensure that research in terms of the impact of climate change on health uh, or the nexus, the climate change and health nexus is prioritized. Then how do we also motivate our national authorities, our research councils, our institutions, and various governments to explore local and domestic sources of funding and other recommendations. So yeah, those are some of the questions that are coming to mind. If you have any thoughts, feel free to unmute or raise your hand. This is an open discussion. Thank you. And if you are not in a position to speak, feel free to use the chat and we'll share your contributions with everyone. Go ahead, Sakari. Thank you. I hope I'm pronouncing your names correctly. Sorry. Go ahead, Sakari. Ali. Yep.
Right. Thank you very much. And thank you, Hashim, for the presentation. For me, it was very striking to see where the funding is going, but it's not too surprising because they are providing the funds and they are giving it to their own institutions to implement it. So we shouldn't be too surprised. So I agree with Samson that we should begin to mobilize our own funds. And I don't think if Kenya has its own funds, investing in the UK or US would get it. But what I want to say is, in order for us to get these competitive funds, we need to also build some internal capacity. Their PhD and they come home and they are lecturers. The teaching load is just too much that these people don't get time to do any postdoc. They don't do anything again after a PhD. There's no development after that. So in the end, they are not very, very competitive. So universities where we can have maybe teaching focused staff and research focused staff. Some universities started this in Ghana, but if you go through the research track, you are paid less than those who are doing the teaching. So it becomes an issue there. But within ourselves, teaching load and having some research tracks to build our own capacity, or even some postdoc positions. Otherwise, people just come and they just teach a lot, and in the end, we are not competitive. This could account for why eventually these funds go back to these high-income countries to be implemented alongside here. All right, thank you.
Thank you. When you were sharing, I just remembered someone was talking about how, in terms of capacity, how because a lot of some of our institutions do not have a track record um, for research, they end up sometimes losing out to some opportunities to to institutions abroad. We have professors and leaders who have a significant record of research and papers. So the issue of capacity that you raised is very important, and I think would love to hear recommendations from everyone in terms of how we can boost that capacity and some of the strategies that are happening that you're seeing working in your respective countries and institutions. Then in the chat, there is a question about God Save asked a question, and where they're saying, do you all think we are moving past mitigation? And that's why most recent studies are focused on adaptation strategies. What does this mean for us? So yeah, if anyone would also want to answer Costa's question, please feel free. If you'd like to speak, feel free to speak. It's an open discussion. Thank you.
Tinash? Maybe so I was going through the chat, and I have seen some colleagues here that looks to be from funder background, like working in funding institutions. Maybe they want to share something with us in terms of while making funding decisions, what are the challenges that they may face while funding for research in Africa in general and climate research in Africa in particular. Maybe we can ask them to speak up. And I've seen Jamie Power, Irina Pantelidou. I don't know if they want to say something, to share something with us, or Tim Housand.
Hi there, Hashim. This is Jamie Power. I'm happy to jump in. Thank you all very much for a really interesting webinar and for sharing the thoughts so far. Yes, I work for the N Fund, which is a New York-based philanthropic organization that channels money from large philanthropic foundations, such as the Gates Foundation, for example, to neglected tropical disease programs all across Africa. The reason I'm on this webinar today is because for about the last sort of 6-12 months, we've been exploring more how climate change will impact neglected tropical diseases going forward, looking ahead to the 2030 WHO NTD roadmap. And this work has reached a stage now. We have published our first ever paper on climate and NTDs. Once I finish talking, I'll pop that in the chat for everyone to look at now. And with a partner of ours as well, Panorama Strategy, we're going to be hosting a webinar on this topic at the start of September, which I think might be of particular interest to people on this call, as the focus of that webinar is to take the kind of global high-level findings from our policy paper and sensitize that to kind of country and regional settings in Africa. We're still in the development process for that, so we haven't got an invite or information to share just yet. But when we do, I'd be very happy to circulate the invite to all on this call as well. So thank you for listening. Any questions I can try and answer.
Thank you so much. And I think it's great really to see like the integration of climate change in ongoing research, particularly around neglected tropical diseases. Actually, before the call, someone reached out and they were talking about uh, climate and HIV programming, climate and you know So I think this comes to mind, like the importance of also trying to leverage on the existing programming that's there, and also some of the existing frameworks that are there, to explore how we can expand, be it indicators and all that can also incorporate information and details about that are relevant to the conversation of really understanding better the nexus of climate change and all. And I'm excited. These are still the early stages of a lot of research, but it's exciting to see already like some of the research priorities that are coming up, or the integration of climate in ongoing and existing research. So yeah, feel
Thank
free.
you very
Any
much, Jamie.
more
I don't know.
contributions? Yeah, go ahead, Hashim.
Yeah. No, I'm just wondering if Irina or Tim Housand or Johanna Sanchez or Ando want to share something with us, or if someone else has question for Jamie or something to say as well. Let's not be shy and open up.
Hi, can you hear me? I'm Yasmin from the Clean Air Fund, working as a senior health specialist. And we're basically Clean Air Fund are a philanthropic organization with a mission to kind of reduce air pollution with the co-benefits of impacting health and climate change as well. I think we've kind of agree with Jamie what you said. Our kind of model is we've set up a lot of lighthouse geographies in different countries. So we currently have teams in Ghana, South Africa, and Kenya. Funnily enough, the ones that you pointed out do have a lot of the funding streams going to climate change. And very much depend on them to identify research groups to fund and in a localized setting, basically, and be the point of contact for research groups to go to. I'm not sure if anyone else thinks about this kind of model, but I think it's been good to make sure that the voices are coming from a specific localized context. A lot of the barriers that we found in Africa in particular, there is a lot of other priorities that people are focusing on, especially infectious diseases and climate change being obviously more focused on non-communicable diseases. So that's one of the barriers that we found to be one of the biggest. And in terms of the mitigation, we've kind of got a lot of feedback to say that a lot of the countries don't feel like they're the cause of the climate change, so they don't want to focus their funding on mitigation strategies, but more adaptation. But there is a role for African countries and members to kind of advocate to support the largest emitting countries to stop the emission and mitigate the emission. Yeah, I think
I think maybe just to add as well, so Yasmin, my colleague at the Clean Air Fund, I think gave a very great overview there. Prior to joining the Clean Air Fund, I worked at the Wellcome Trust in the Climate Change and Health team, and I see a few of the grantees on the call today who have really been like fantastic examples of like really competitive, really impactful research studies. I think while there, and not speaking for the Wellcome Trust now, but some of the takeaways that I took from that role was there being kind of an increasing focus on capacity strengthening efforts and actually what that means and the time that does take. There being kind of a need for better monitoring evaluation around what works and kind of more time taken to co-create the research studies and then see through. I think funders do tend to still fund in the short term, and actually that also needs to change. And we also try to make efforts to overcome some of the language blocks, particularly for certain regions that bring together kind of those different backgrounds. And so I think there's kind of competing priorities there, but really have seen an effort from funders to try and be more equitable in the funding. And I think Wellcome Trust as well is one of those.
Oh, thank you so much for the contribution around capacity. And I think reflecting on like the earlier contribution around the importance of capacity, I'm thinking about how can we also sustain um how can we sustain it long term? Because one of the challenges you find sometimes is we have incredible scientists who are involved in research that are funded by the various programs, and often because their national institutions do not pay as much. There's usually sometimes like internal brain drainage within countries where people go to the private institutions, or sometimes external brain drain. So I'm trying to think about it in the context of resilient health systems. And I think one of the key things that we should also start thinking about, and I think when we're engaging our governments, our national authorities, and different players in the health space, is to really think about the importance of resilient health systems. And I think research is also a very important component for that, because I think that's a more holistic and sustainable long-term way of ensuring that not only are we able to research, but also we are able to respond, and we're also able to retain and also improve the capacity within the countries, and also eventually win ourselves from donor dependency. On another platform, people were arguing that our health systems, if you're not really talking about this research, it's not the findings of this paper are not surprising to a lot of people, because our health sectors are heavily dependent on donor funding, and and I think there's need to have both accountability both ways, like even holding our own authorities accountable and encouraging them to invest more in health. Then at the same time also working with our international community and they have decolonized frameworks, research. Sorry, my network had dropped. But feel free to share your thoughts. Sorry, I think my network dropped along the way. Yeah, but yeah, feel free to share your thoughts and your contributions. And I'm particularly interested in hearing people who are part of research institutions in their countries. And oh, go ahead, Joanna.
Yeah, just responding since you did call on me earlier. Yeah, so I represent Grand Challenges Canada. We are newer in climate and health. Definitely invested a lot in global health and humanitarian work, but we are building our climate and health program. We did fund some research 2 years ago, sort of as a way to understand what appetite there was for climate and health. Most of our funding, over 60%, went to the African continent. And we expect the same will happen in the next call. So we're hoping to launch a new call in 2025. But what we're really seeing as we do our scoping review and landscape analysis, as we set up this new grand challenge, is that not only is there a gap in low middle income countries, particularly in Africa, but we're also seeing a lack of coordinated and collaborative efforts. We also need to come together at the local level. So we need not just to create more silos and more separate groups, but we also need to see how there's an opportunity to create that strengthening. So, you know, even if there isn't the capacity at the university level, for example, research within health systems, together that you can create quite a lot of power if you bring a lot of the expertise in the continent, or even regionally throughout because it's a massive continent. It could also be distributed. And I know there are some groups working on creating hubs, Welcome being one of them, are creating data hubs in an effort to sort of consolidate data, contribute to the lack of data. And so what I am encouraged about in the funding world is that there is a lot of collaboration also taking place among funders, and we are all coming together and speaking a lot, you know, where is everybody going to fund? How do we engage local voices? But a big push is definitely how do we create these coalitions, these collaborations? And I think that's another thing in addition to the gap. You can sort of strengthen that gap, or at least strengthen the expertise by sort of linking everyone together, because there is a lot of strength and knowledge and it's just dispersed, right? Everyone's kind of working separately throughout the continent, throughout the world. And so hopefully as climate and health picks up a little bit more in the funding world, and it's picking up very fast, we're going to be able to build this. This is an opportunity to build something new, and hopefully we can all work together on that.
Thank you, Joanna, for your contribution. And I think you touched on an important part about collaboration. I know I was going through some of the Africa CDC work, and I know most of it is they're doing incredible work as far as setting up various institutions and centers, or supporting national public health centers. And I think if those centers could also integrate climate change and health in terms of their work, I think that could also be a starting point around collaboration. And another thing that I'm excited about, I'll share the link, is there will be the first ever climate change and health conference in Africa, which will be in Zimbabwe. So I'll share details about that. I think these are some of the platforms that we can also explore in terms of opportunities for collaborations, opportunities to learn from other people and other work that's being done. I know Kenya, South Africa, I wasn't surprised to see them on the in the paper. They've been doing incredible work. But how does it translate to more collaboration at a more continental level? How does it translate to more South-to-South partnerships and collaboration? Yeah, it's something that we can think about as we're working on this, so that we don't reinvent the wheel, but we also continue learning from the strength and some of the work that's being done in the region.
Thank you. Thank you.
Are there any more questions, any more contributions, any more thoughts about what's been shared so far, or even reflections related to this based on the work that's being done? I know some have mentioned that their implementation partners are on the call. They can also reflect on their lessons from that in terms of, and I think I can agree that a lot of funding is coming to is coming to towards climate change and other. I know last time I saw a call for setting up like regional hubs and centers for research, which were targeting institutions in Africa. So so that's another important thing that we have to think about as far as our local institutions ready to take up to take up that and to lead some of the research on the ground. Yeah, and how can they be better coordinated? How can they build a better capacity? So yeah, looking forward to hear from you and from lessons from other institutes and from even from individuals who've been involved in research before.
Tinashe? Okay, Simpson. So I was maybe before you give him. So I was just wondering if also Zachary, that's working on with the climate and health research with the Lancet Countdown Africa. Maybe he want also to share some thought with us. But I leave Simpson first.
Thank you, colleagues. So, Tinashe, my thinking is that we need to build local capacity. But for that to happen, there should be willingness on the part of the current fund holders to build that capacity, and also to be coordinated by the institutions within those countries that they want to support and build capacity. And that also includes giving the countries ownership of the agenda through co-creation of the research agenda, rather than coming with a finished product and say, this is what we want to research on, and then direct the research, direct the methodology, direct who should be participate. We need to have some co-creation that is done with the local institutions, with the local governments. And that capacity cannot just happen overnight. It's a sustained effort, but that should also be something that the current fund holders should be willing to do. Otherwise, we will have a one-sided situation where the funders will continue to determine what is researched on, who does the research, and who disseminates the research. Thank you.
Hi, Hashim. I thought I should jump in here. This is Zachary. Yeah, about the capacity building. I think some institutions have started, and some funders have also started some initiatives about supporting African emerging leaders. There was a call, I think, last year from the UK MRC, giving 5-year funding to those who have just freshly finished their PhD. And Welcome Trust has those. I think they are very, very competitive. But if we can get most of these funders more tailored towards Africa, this will help. I think at the moment, most of the funding is open to everybody. And in the end, those who have the big professors to support them, they end up getting. But these funders are also having a lot of consultations within Africa. I think there was a consultation in Kenya last year by Welcome Trust, and they are beginning to understand how they can tailor their funding to support African researchers. But I think where we can start from is the postdoc level. When people finish their PhD, we need to train them a bit before we overload them with teaching. And if we have funding to support these ones. And sometimes when they are in research institutions, postdocs are the most unstable staff members, because you are expected to work under some project or to bring your own funds. You don't have the experience to win these competitive funds. So what happens is some very bright postdocs just end up going to NGOs where it's, well, the expectation to publish and to get funding is not as in the research sphere. So it's more about building the postdocs, but also making the opportunities available. And I think a network like this can also help when we see some of these opportunities to highlight it, send it across so that people can see. Sometimes these calls doesn't get to the people who are supposed to apply. Them in this club to be able to do this. But that's my point. Hashim, if I can come in again, I think international collaborations are not global enough, have a lot of experience. In as much as we want to maybe have our internal funding, we want to get more of the funding. We should also emphasize that we need the skills they have over there. So we cannot break away too quickly. We need to have a lot of collaboration with them, do some placements at their place to bring their expertise down. Sometimes the reason the funders don't give us the funds is they don't think we can implement some of these because the expertise set of our teams, they don't see that if they give us that money, maybe our institutions or even the researchers can manage it. So we need to move gradually as we build the expertise base, and then we'll be able to self-run some of these. In our institution, we are bringing what we call the Lancet Countdown on Climate and Health in Africa. It's a global collaboration, and we have 5 other centers in other regions. We have South Africa, we have Europe, we have Oceania, and now we have one in Africa. So this is going to, most of you might know about the Lancet Countdown. It publishes this global report on climate and health. Now we're going to have a center in Africa, and we are going to have people working with the global co-authors or the global researchers to try and build the kind of expertise they use to generate the global report in Africa. So these are some of, it's going to be a collaboration, but with time, we can build some substantial expertise within Africa to highlight the many ways that climate change is affecting health.
Ali brought in a very good suggestion around postdoc. It reminded me, I was talking to someone about a PhD, and they were saying that most PhD holders end up just doing teaching and not being actively involved in research. And I think as we start having more like research projects going on the continent, it also means even PhD students and postdoc uh, we have opportunities to to gain experience on the ground for them to continue doing and also build capacity in our various institutions. And I think it also, one of the most important thing will also be the institutions having the capacity to retain those brilliant people, which is why I also like the health systems strengthening approach is quite important, thinking about human resources, remuneration, and other some of the factors that are pushing some of the brilliant researchers to outside. Because sometimes even if you look at some of the research being done abroad, you'd find that some of the cohorts and some of the investigators are actually people who at some point away from from a different countries and institutions. So it's and Samson brought in another important point, like emphasizing on the importance of co-creating. And I think that's one of the most important things, particularly when you're talking about capacity building. Co-creation is a very important element. So we're left with about 6 minutes. So yeah, so I don't know if so you're welcome. Everyone is welcome to share if they have their final thoughts around this topic. Then we also welcome recommendations on papers and topics that we can discuss in future sessions. As we emphasize, this is a collective space for us to learn from each other. We have also created a Google group, so I'll share my email address so that if you'd like to be added to that group, please send me an email so that we also continue this conversation offline. In case for those who do, in case people have resources and other opportunities that they would want to share. So yeah, for the last 5 minutes here, we'll open it up for any final remarks, thoughts, and comments. Go ahead, Vitalis, then Nathaniel.
Thanks, Tinashe. So I think one of my remarks would be, well, while we speak about funding not coming from Africa and most of the funding going to European and American institutions, our own institutions locally also need to build the capacity of our own researchers to be able to, look more into climate change, its impacts on health, etc., etc. To ensure that we have our own capacity even to lead our own research without waiting for funding from elsewhere. Because I think in our local institutions, this is not really topical in some of them. We focus on the usual issues, NCDs, CDs, but really without looking at other global issues that may be affecting our healthcare system aside from the disease burden and the other funding issues as well. So yeah, I think our local institutions really need to increase more on the funding and on the training of young and upcoming researchers to be able to really delve more into the impacts that climate change is having on our health system. Over and thank you.
Thank you, Vitalis, and go ahead, Nathaniel.
Hi, Tinashe and Hashim and everyone. Sorry to join late. Just wanted to share that I think being present in the spaces where these discussions and decisions are held is important. So briefly, just wanted to put a plug in that if anyone is looking to follow up from the Climate and Health Conference in Zimbabwe in October, the next month being COP29 in Azerbaijan, where the discourse surrounding climate and health is increasingly important. There will be a day dedicated to human capital where health will be emphasized. I believe that one is November 18th or November 20th. But just wanted to encourage all of us to continue showing up collectively and to move together to increase the representation to the point where we have much more appropriate and equitable decision making and just being a part of the discourse and how important it is to show up where these decisions are held. So thanks again for the space. Looking forward to moving forward together. Thanks.
Thank you so much, Nathaniel, and please do share the link to the event you mentioned. And thank you so much about raising the importance of people being in the space, and also for Vitalis for emphasizing the importance of capacity building for our institutions. So we are almost on time. Thank you so much for everyone who took time to really share your thoughts and your contributions. We're going to follow up with share the links that have been shared on the listserv and also the recording to the session. And we welcome your thoughts and feedback on how we can improve future sessions and also what topics and papers we can suggest. I'll give it to Hashim to give the final remarks. Then we end it. Thank you.
Thank you very much, Tinashe. I'm really, really, really grateful for everyone who was able to join. We do not have a club if we are all alone, and having this diversity of people from different backgrounds, from different regions, willing to come together with us and talk on issues that affect all of us is just magical. And I'm really, really, really grateful to everyone who were able to contribute. And yeah, let's make it happen. Thank you.
Yes, and lastly, thanks to AIM. I hope I pronounced your name correctly. He's been doing a lot of incredible work in terms of designing the posters and interpretation to ensure that language is also not a barrier in this conversation. So we're really, really grateful for everyone, and yeah, and also grateful for for the people. So this is a voluntary effort where everyone is putting their own resources towards creating this space. So we really thank everyone who's putting their time and their resources for these collective conversations, and looking forward to more enriching conversations. Have a lovely day.
Thank you and bye, colleagues.
Bye-bye.
Thank you. Bye-bye.
Thank you and bye.
Thank you.
Thank you. Bye bye.